CBS News.
Americans are grasping for ways to brace for what public health experts say is inevitable, an outbreak of the coronavirus.
And I remember being in a meeting on February 3rd, and our Asian Pacific Family Center staff had been requesting gloves and masks because they'd been hearing from their family members in China that we needed to prepare for this.
I think in the beginning it was scary. We didn't have information. We were following daily reports from the federal government, from our state, listening to other states that were impacted by COVID, but we knew that this was serious and we needed a plan to address it.
We really had a sense that this could affect us sooner than later, and our expectation was we may get an order to shut down and we may have to shut down at any time.
All businesses, including museums, malls, retail stores, for-profit companies, and nonprofit organizations must stop operations that require workers to be present in person.
It was definitely a fire drill, in that we were moving quickly. So we had our IT team, we had our facilities team. We were moving every day, giving updates.
Our medical director had various different contacts across the world, and we were able to get PPE very quickly for our staff. And we're talking doctors, nurses, therapists, all those levels of people needed to be equipped literally overnight.
When you're dealing with med support management, you're dealing with injectables, you need to incorporate individualized services, but yet respecting that we need to do so in a safe and most productive way.
We only shut down for 1 week. So our clinics were only closed for 1 week for us to prepare.
We closed our sites physically on March 20th, and by Wednesday of the following week, on the 27th, we were able to reopen and begin providing the vitals and the intramuscular injections. We also worked with local pharmacies for the injections as well, and we still continue that.
Of course, we were very concerned about the families we serve. The children and the Head Start program really depend on us. So Head Start started rolling out a food distribution plan, including lunch for those who are homeschooling. And the adults in our residential housing program, our team leaders quickly started putting together plans to provide emergency meals.
My VP of IT got on the phone and started looking quickly to figure out how many computers we were able to grab.
We gathered hundreds of laptops. We repurposed some of the laptops that we had, like in our training rooms and other sites that were closed, not using them. We repurposed them.
We've also ordered Chromebooks, which we have provided a lot to our families, especially in Head Start. We did additional 100 cell phones. We ordered 5 telehealth life-size equipment units. We got webcams for a lot of people. Video conferencing was a challenge in that we had not used a lot of video conferencing to that point.
And then when it's like, okay, we'll use this Zoom thing, I'd never heard of it. Okay, we'll try that.
And then I had to contact every family, letting them know what was happening and that we're gonna do this remotely, but our sessions are not gonna change.
So working from home, we have our laptops set up. So we had Zoom set up in our computers.
Your thoughts affect your feelings, and your feelings affect your actions, right?
I didn't think it would be this long, but I'm so glad that Pacific Clinics was able just to quickly flip.
And this has drastically just changed our view, our perspective, and our approach of using technology to provide services.
Now you're seeing them sitting in their bedroom or on their kitchen table, so you're seeing siblings, you're seeing pets, you're seeing really how families are interacting and all of the different dynamics. So really I am getting a window into even just their day-to-day functioning.
You know, they're comfortable in their setting, so they're very natural. Sometimes they forget that I'm there, so I'm able to see the real interactions that they have with one another.
You know, they'll even go to the kitchen during session and they'll prepare a sandwich and they'll prepare a snack during session. So we're seeing exactly their habitat. We're seeing where they live, how they live, and who lives there. And by seeing that, we could get so much enriching information out of that. We could get more out of that than we would do of weeks of services of us seeing clients at the school or the clients coming into the office.
it's just been a mind-blowing experience. To see them in their home, to take a tour of the kids' bedroom or shared room or living room where they sleep.
I think it's the wave of the future. We were really pushing on it ahead of time. Prior to COVID, we really wanted to do this. There's just a greater connection. There's a greater human connection. So it shows the clients prefer it. We get more out of it. And also you see all the social cues that you're not going to see over the phone.
Well, hey Marina, what's going on? How are you doing?
Hey Matt, I'm good. Today's a good day.
Yeah, for the most part, most of my clients have been receptive to it. It's been an easy transition for them as well.
I can be anywhere in my home and we can have our sessions. I could be in the kitchen or the living room or the bedroom. I can find a quiet place, especially if my kids are around and they're making noise. I kind of go to a quiet area. So for me, that's like really great. And then there's something about just the comfort of your own home where I feel real comfortable being here as opposed to maybe being in the clinic. You know, even after the pandemic, I actually still like to be doing Zoom, you know, every once in a while.
Our consumers are feeling a little more comfortable in a different era where they're not face-to-face with their clinician, their therapist, their doctor, but they're receiving care through a video screen.
We can have clinicians really maintain that close contact with people if they can't get to them, especially in times of crisis and emergency. I think that this really kind of forced us overnight to get comfortable with technology that we all have been kind of seeing coming for years, but overnight we just had to. And I think once people have gotten comfortable, it's going to change.
I think it's a great way to engage clients who maybe struggle with transportation or they're missing appointments for various reasons. That down the line we have learned as a clinic that we can do things from home. So I think down the line we can integrate both to better serve our clients.
And I think also barriers come down. People get a little more relaxed when they're sitting in the chair in their own home versus if they come to a doctor's office or a clinician's office.
So I think a hybrid of both works best. We really have to discern which clients are appropriate and which clients are not appropriate. For some, it's been really, really great, especially with transportation issues, large families. I really seen some of my clients thrive off of that, and especially if I want to see them multiple times, it's a little bit easier.
The ability for Pacific Clinics to continue its life-saving services, to focus on our mission, it's been through the adaptation of telehealth.
Telehealth is here to stay. We were doing this 3 years prior to COVID, so our transition made it a little bit easier. But now we've learned so much in terms of ease of access. We've conducted on average almost 1,000 more sessions per week during COVID than we did pre-COVID.
So right now, our consumers are faced with absolutely unprecedented times. They have the COVID-19 virus, which they are at very high risk for. They're being asked to stay at home alone and isolate, which has detrimental effects on their mental health. They are in a perfect storm of stressors and fear, depression, and anxiety. They need us more than ever.
We need to keep connected. The social piece of people's mental health is critical, but having people being isolated in their homes, mental health is needed more now than ever before. We must keep our consumers safe, we must keep our staff safe, but we also must treat. We must find ways to do in-person services when necessary, and we must find ways to keep people physically distant, but not socially isolated.
Because we have a shared vision, we have a shared passion of wanting to save lives and change lives, because that's what we do. We have a resilient team, we have a passionate team who are eager to provide quality care and services to clients, and that's our drive.
We have an extraordinary team at Pacific Clinics. They're dedicated, they give beyond self, and they care about others. And during this pandemic, it was never more evident. Pacific Clinic services and programs are needed more than ever. And we're so grateful for our donors that continue to give unselfishly, knowing that their dollars will go further during this pandemic to really impact the lives of those we serve. But we can't make that difference without the support of those who believe in what we do at Pacific Clinics, and we're grateful.